for a child who's gone through any form of trauma in their childhood, what may have been, I guess, in quotes, adaptive for them back then is something that they mistakenly carry into adulthood.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is clinical psychotherapist Scott Stolarik. He specializes in trauma resolution, sexual addiction, and couples therapy, and that's what we're going to be talking about today, as well as his use of EMDR to help people deal with trauma and mental health issues. Scott is the founder of Mosaic Pathway Counseling, and he is committed to creating a very safe therapeutic environment. So let's jump in. This is Scott Stolarik. All right, Scott, we made it through the technical difficulties that we had.
Yes, we did.
And like I said before, I was pretty calm, and then I got trauma.
Right. That's not how this is supposed to work, right?
No. I mean, I'm joking, but of course, big topic. It's as I was mentioning to you, it's one of the things that comes up quite a bit in this show. Certainly, I think, being a human being is kind of traumatic in itself. You don't know that when you're a little kid, hopefully.
Right.
It's one of those things that I'll just, speak for myself. I don't have any major kind of events, just sort of ongoing things that have happened over the years that everyone kind of has to varying degrees. But sometimes that stuff just it feels like it's living in you somewhere that you and it's running the show sometimes, and it's taking over moments, or it's informing behaviors that you may not even want to participate in.
Yes.
It almost feels like it's a very sort of dramatic and severe version of that causes reactivity. Let's put it that way.
Absolutely.
So that thing or things or ongoing things that have happened to people, you're almost a slave to it. Not all the time, but sometimes. And it seems like it's, for me, those things that have gotten in the way that way, they get in the way of a lot of things.
They do, yeah.
Accomplishing things, or keeping you afraid to try things.
Sure.
And I know that you deal a lot with, some very severe trauma with people, like sexual abuse and things like that. So why don't we talk about a little bit about what you've been doing, and some of the things that you've come to, dealing with this, because you're talking to people all day long about this.
Yeah. No, thank you. I've been in practice over 30 years. I work in Lake County, Illinois, which is on the border of Illinois, Wisconsin. I've worked in this county most of my career. I started out as a counselor working in a correctional facility, our county jail. My next job was working with the court systems, dealing with court-ordered clients, and specifically sex offenders. And I did that for 26 years and have done youth services work for police departments. So a combination of all of that really gives you a heavy dose of trauma that people experience. You learn a lot about their respective journeys and really challenge yourself as a clinician to try to come to understand it and appreciate and respect the journey, but also put yourself in a position to help the other person navigate it. I opened my own practice a little over 2 years ago, called Mosaic Pathway Counseling. And the name I chose was kind of a culmination of this vision I had of people being essentially built like a mosaic. You know, we're not defined solely by one part, positive or negative, but we're comprised of a variety of different experiences in life. And working with those who have committed sexual crimes for the years that I did really helped me to kind of understand their journey a little bit better, but also the need to work more on the other side of this for my own clinical nourishment and desire for advocacy. So, in a nutshell, that's kind of how I landed here, where I am today, and I'm happier for it. I really feel like I'm making more of a difference, working directly with trauma and empowering those to navigate it.
I was always curious, since you've been in this field for a while, what do you think the percentage of people that are that commit sex crimes or sexual abuse have been victimized themselves? What do you think that it's? I mean, in your experience,
I think the statistics that you see on the internet or elsewhere are overblown. I don't think it's, I've seen 80%, I've seen 90%. In my experience, it's not that high
mm-hmm.
In terms of the person having been a sexual abuse victim. However, having said that, I will say that 80 to 90% number applies to just trauma in general. Perhaps an abusive parent, verbally, physically, neglect as a child, bullying, things like that, I think are more prevalent in a person who comes to that place in life. But certainly sexual victimization was a part of cases that I saw. I would say less than probably half.
Mm-hmm. Okay. Yeah, I was always curious about that because you would hear, oh, that must have happened to them. But, and then I wonder, and there's no way to really, I don't think, quantify it, but so what percentage of those people they just come in the world wired a certain way?
You have to wonder. Yeah, you have to wonder. I mean, you look at cases, of individuals who sort of had the run of the mill upbringing, nothing known to the public, at least, that is, acutely traumatic, but yet they end up doing, horrific things.
Yeah.
It is a head scratcher. I think one day science and research will be able to target that a little bit better, but you do have to wonder, and I often have thought that myself.
Oh, okay, good.
Yeah, it's got to be a thought that crosses people's minds, and you work with people in your career, and I know I have, especially in a correctional facility, where you can't help but walking away feeling like, this person was just sort of wired this way. And I don't know if any process of unwiring can occur to get them back to a place of pro-social living. Now, that's certainly the exception, not the rule of my experience. I'm more a believer that, people under the right circumstances can be helped. But it's, you have to really commit to helping them as well, because they're not, by and large, they're not all willing recipients.
Like if somebody doesn't want a certain amount of help or is not willing to even take a look, there's not much you can do.
Right.
Uh, and that really is to me, that's a big part of just being successful at life is what am I willing to take a look at in myself that is going to help me,
Exactly.
or that it's going to be unpleasant to see and take a hard look at. And that's I think is sort of the tricky part about any kind of therapy is when you start to look at yourself and then you don't want to look anymore
Right.
because it hurts
Right.
or you're afraid. I had a therapist once say to me, most people think that if they uh, start crying, they'll never stop.
Yes.
That's what it feels like.
Right. Right.
But then she starts laughing and she says to me, most people can't cry more than like an hour. I mean, they may have to do it again, but she goes, it's not like it's
Well,
not like that's an actual real thing, but that is the visceral response you have to these painful memories,
yeah, it's like, if somebody says, gee, I don't want to pass out. Well, I understand that most people don't, but also realize you'll come to. you know,
Yeah.
you'll pass out and you'll reawaken, and I think it's similar to the crying example you gave. Is that it's certainly not always a pleasant experience, but it will not go on forever, and there is healing within that.
And I'm sure you've seen some people just come very far from where they were when you started seeing them. That must feel just amazing to see somebody who's been trapped in a way of believing and reacting, and then now they're becoming people that can do things they couldn't even do.
It is gratifying to see that, and in a way, I you know regret that I didn't do it more in my career. And that's not to say that I didn't have rewarding experiences with clients, but, you know, helping someone navigate their trauma and get to a place where they feel like they can adaptively cope is a rewarding experience for sure.
When you do EMDR, how long of a period of time till you start to see some pretty great results? I'm sure it varies with each person, of course, but
It really does. It really does. I've seen folks get to target issues almost immediately at times, and really do some active and thorough reprocessing within the first couple sessions. And then there are other people where it just is a bumpy process where they have to do it, take a break from it, come back to it. It's all, I think, the clinician really being trauma informed and reading the journey that is playing out before you and being able to respond in a manner that's accommodating and conducive to healing. Sometimes therapists have their own agendas that they want to move someone through, and if you do that, you risk missing something important, or making the client feel like they have to take shortcuts or accommodate the therapist. And in those cases, you may get some of the work done, but it's very likely that person may show up again in the future to clean up what's left.
I mean, to me, the most important part of all that kind of stuff is to make the person feel safe.
Absolutely.
Because if you don't feel safe, and that takes time, especially when you're somebody that's been wounded by another person, it's like that to me is like the big chunk of the beginning of the work is that. It's like how does someone feel like they can say whatever they need to say without being judged or re-traumatized, really, in
Sure.
a sense, because sometimes when you talk about stuff that happens, you feel it again.
Absolutely, you do. And I think, speaking specifically for EMDR, I have many people who contact me and tell me they want to do EMDR, and that's great. And as I get to talk to them, I ask them, what brought them to want this and how come they want to do it. And they'll say to me, well, I had a friend who told me that this is really good and I should try it, or my doctor said I should give it a whirl. And that's great. But every client I have who wants EMDR does go through a period of extended informed consent on my part, meaning I will send them videos and literature to begin, and we'll have some sessions talking about the expectations of the process, as it is not traditional talk psychotherapy. And going into it, they're ready, because frankly, it can be pretty intense at times. An individual can access something that they didn't feel they had access to, and they may not be ready for that. Um, so going into it, they have a full understanding of what the process looks like, my role within it, and the fact that there's really no right or wrong, and to get their mind away from the question of, am I doing this right? Am I, because that's not an additional layer of self-questioning that they need. I use a light bar that I set up in front of them so their eyes can track the movements back and forth. There are tactile stimulators they can hold in their hands. There are audio sounds that bounce back and forth from one ear to the next. So they have kind of a choice of what they want to use. And for them to understand all those bells and whistles before they get into the process is very important to me. So they know more about the journey, because too much of their life coming to this point has been undefined. It's been gray. It's been unclear. It's been them walking through a dark room and not knowing where the furniture is, so I want that part at the very beginning to be clear. And I want them to feel safe going into this. Yeah.
I know I don't like to talk about unpleasant things. I just don't like it. I had a friend who was telling me that when he got married and he had some issues coming up in the marriage and his, and himself, and when his wife would talk to him about some of this stuff, he would fall asleep just sitting up in a chair.
Sure.
Because
Yep.
I just checked out. I
Yep.
could not talk about it.
Yep.
Took him years to be able to, to be in therapy and to see what had happened in his childhood. There was a lot of physical abuse that went on in his house, and it's an amazing thing that the human body is kind of brilliant in that we're able to check out in a variety of ways.
Yes.
Some are really obvious, and some are just like, I'm going to go to sleep.
Yep. Yep. It's just blatant, like I'm out of here. Yeah. For sure. For sure. Defense mechanisms vary so much across people. And I think what I find is that for a child who's gone through any form of trauma in their childhood, what may have been, I guess, in quotes, adaptive for them back then is something that they mistakenly carry into adulthood. So, for example, the friend you were speaking of may have, during a traumatic household episode, gone up to the bedroom and gone to sleep and shut the door and, just detached and cut out from that. That's of course just a guess, but it is often carried into adulthood, and those do not translate well, as you can imagine. So there are defense mechanisms all across the board. And I think a big part of therapy is to let someone know that it's okay to defend. It's okay to keep a distance between yourself and something that's traumatic, but to try to find adaptive ways to do that, or healthy ways to do that. And it makes a world of difference.
Yeah, those survival tools become no longer necessary at some point. Hopefully, they
right.
become
Correct.
And then you can say to those to those things, not that they're bad and you have to get rid of them. That is, I no longer require your services. Thank you for helping me when I needed it.
Exactly. Exactly.
I want to talk a little bit about couples and marriage and
Sure.
relationships, whether it's a romantic relationship or any kind of relationship, but generally in a marriage or a couple relationship. Those are very obviously the most intense relationships that we have.
Mm.
And you've got it's amazing that any of them work actually when you got you got two people coming from two different places, different sets of parents and
Oh, sure.
circumstances.
Sure.
There's sort of, and then you get past uh, physical attraction. I'm not saying it goes away. I'm just saying you once you get past physical attraction, even personality and
Sure.
character and all those things, then you're down to that core sort of being
Yeah.
that moves through the world with these varieties of experiences that they bring to the table, and sometimes that clash
Yes.
is really hard. And even sometimes, even when you both know what it is, it
Yes.
doesn't make it makes it easier to understand,
Right.
but to have compassion on the other side of total sort of total impatience with the other person's behavior. You're doing it again. You're driving me
Correct.
crazy. It's almost like you're doing it on purpose, or you're not working hard enough, or to overcome these things.
Yes.
And it's really that to me is like where the sort of rubber meets the road in relationships, is that stuff, because it's so intense sometimes.
It really is. When I work with couples, and it's a big part of the work I'm doing at present, one of the requests that I make of them at the onset is that after we have our introductory meeting, that they permit me to do a social history interview with each of them individually, so that I can get familiar with their family of origin, their upbringing, their relational dynamics in their formative years. Because having a familiarity with that really puts me in a position to help them navigate these barriers that they may have brought to the relationship prior to even meeting their partner. And as you said, those are things that are present and available and visible, but they don't always know what to do with them when they come up. So that's kind of where I try to come in and do some education and some integration work with them, so that those kinds of things don't become more increasingly toxic throughout the life of the relationship.
Yeah, because you come in with these two different paths, and somebody may do something, and the other person takes it one way. The other person's intent was not that, and
Exactly.
so you've got an immediate conflict. It's like, that's not what I meant.
Right.
Yes, it is. I know what this is. Now you're lying. I'm
Right.
just picking sort
Sure.
of
Sure.
weird
Yes.
conversation, and it's a frustrating thing, because especially if the other person thinks, well, it can't be this thing you're saying, because my experience says that it's not.
Yeah. Yeah. Exactly. Exactly. The book, The Five Love Languages, kind of a pop psychology book, but one that I think has a very valuable premise behind it, in that all people do not experience love the same way. And it's very natural for somebody, if they know how they experience love, to try to give it to someone else in the same way. But if that other person has what they call a very different love language, then you're missing the mark completely, and trying to, engage or nourish your partner. So that's a good book that I often refer to when working with couples.
It's kind of an interesting idea that you're formed a certain way to experience love, and it's different than another person.
Yeah, yeah, it's fascinating, and it's definitely worth taking a look at, because not all people um, not all people experience love in the same way, and maybe some people haven't really experienced it at all.
Ooh, that would be tough. That
Oh
would be
yeah.
tough.
Oh yeah. Yeah. Absolutely. Absolutely. And I've seen cases like that as well, and it's just very sad, um, because you're talking about really severe attachment issues that happen with people, and that by itself is accompanied by so many other problematic uh, traits and behaviors.
The the part of it that is beautiful and scary is the vulnerability part of it.
Yes.
And if you're somebody that is okay with being vulnerable, you feel safe to do that,
Yes.
that's a whole different thing than if you're even experiencing love and you feel vulnerable and it's frightening to you. That feeling, which, has now is coming from a love situation, an intimacy thing,
Mm.
but maybe in the past that vulnerability was coming from something else.
Yes.
And so it maybe, I don't know, can people not, I guess you sort of don't, some people may not be able to differentiate. They just know the feeling is terrifying.
Yep. They know that on a more raw level, but maybe not able to label it specifically. Exactly.
Yeah, because there's a feeling sometimes with vulnerability, and I think everyone has this to some degree, especially when the stimulus is not a positive one. You feel like a cornered animal,
Yes.
and so what do you do? What does a cornered animal do? It attacks,
Mm.
or it retreats completely, or it attacks and fights like it's going to die. It feels like death,
Yes.
and those those feelings are so beyond thinking.
Yeah. It's reactive. It's impulse. It's just raw reactivity. Exactly.
And isn't that sort of the idea that EMDR underneath it is that you're accessing a part of the brain that's not accessible through talk?
An example that I give is if your life, as it exists both in the past and in the present and moving forward, is like a giant rope that just keeps getting stretched along through time, and the mundane, normal, casual, everyday experiences are just flat areas of the rope, not disruptive, just, right there. But the more traumatic areas of life are knots, like small knots, big knots. And when you come across reminders or triggers of those experiences, you hit that knot like a giant pothole in the road. So EMDR is based on the premise of bilateral brain stimulation, activating both sides of the brain to help reprocess negative traumatic memories so that you don't necessarily forget them, but that they are just more integrated into your system like other memories are. You don't forget they happened. You are aware that they were negative things, but they don't hold you back, and you can experience a trigger connected to them without decompensating. The eye movements back and forth are essentially the stimulation of each side of the brain. The vibrating tactile pads that go back from one hand to the next are bilateral brain stimulation, as is the sound that would bounce back from ear to ear. So what it does is it takes that and tries to adaptively introduce positive cognitions to the experience that make it less daunting and intimidating for the person experiencing it.
Have you tried EMDR on yourself? I mean, I guess you can't do it to yourself, but you could have somebody.
As part of our training, you have to go through it. Yeah.
Okay.
And it's, it's pretty wild. I mean, in the trainings, they suggest that you don't pick what they refer to as a big T trauma, but maybe something that's more, smaller scale. So, for example, for me, I chose a fear of spiders, which I'm very fearful of to this day, but not to the extent that I used to be. So that was my target experience there. But yeah, you do have to know what it feels like to be on the other side of it.
I didn't really know what the training was, but I think that's probably a good idea to try it.
Oh yeah, for
Because
sure.
I know talk therapists have to go through talk therapy.
They definitely should. If they don't have to, they definitely should, because it's just a vital piece to the not only the development as a human being, but the development as a professional clinician. I think you have to be in touch with a lot of that stuff.
You know what I've experienced periodically? I guess we would refer to it as intrusive thoughts,
Yeah.
where you're all of a sudden you're thinking about something that bugged you, like, let's say 20 years ago. Maybe you haven't even thought about it hardly at all. Then all of a sudden, I'll be thinking about something that
Yes.
really bugged me at the time, really bothered me, and the thought is, not only is it bothering me, I now try to take myself back to that time and do something else in a scenario in my head. So
Mm-hmm.
I should have done this, or what if I had done this thing instead of what I did? And there's a little bit of some relief in that you're reliving the experience the way you would have liked to.
Sure.
Um, and then there's also regret that you didn't,
Mm-hmm.
and sometimes an idea of like, why didn't you do that thing back then? It's almost a weakness or a humiliation. There's all
Yeah.
these different sort of aspects to these events that happen,
Mm-hmm.
where you're trying to figure something out and change something that can't be changed because it's in the past.
Right. Right.
Um, and that stuff just bugs the shit out of me when it happens.
A
I'm like,
big
go away.
a big part of EMDR specifically is just that. It's referred to as scripting. You can identify something historic, when you're resourcing the client for coping mechanisms, developing things like what we would call a safe place. They're given coping skills to deal with perhaps minor annoyances that occurred in the recent past, and to go back and to relive that, but with the resourcing that they learned and the things they could have done that maybe would have made it less annoying or frustrating or traumatic. So that scripting, that has value.
If it helps, I guess then it does have value. Because my sort of analytical part of my mind goes, well, that would have been great, but that's not actually what happened, is it?
Well, and people, I think different people wired differently will use situations like that as motive, to make sure that whenever they're confronted with similar situations, that they make sure they do it successfully, or they do it, well. Athletes experience that quite a bit. Being in Chicago, we all got to see Michael Jordan's career up close, and he would often talk about past failures and getting cut from his high school team, and how that just drove him maniacally to succeed. So you have extreme, versions of that as well, where people use it as a motive. They just hold it
Yeah.
in front of them.
Yeah, I've done that too. It's like,
Yeah, for sure. Yeah, yeah.
it's like I'm not doing that. I'm not doing it that way again. That
Right.
didn't get me anything. I'm gonna try to do it a different way. And then if you do that and it works, you're like, oh, good. Okay. There's a lot of people that get hurt by certain situations, and they make a determination in their head that they're going to not have that happen again, and they're going to do the work that it takes to not have that happen again. And so
Absolutely.
there's a lot of successes come out of that.
Hey, we just saw, I don't know if you're a sports fan, but Sam Darnold just winning the Super Bowl. Great example of a guy who's had a really trying career up until the last couple years, and really changed things around for himself, and found great success in doing so. So you see that a lot in athletics. That's why I
Yeah.
like watching it so much.
Well, it's a very concrete thing to witness because there's winning and losing. It's really kind of black and white that way.
Yep, exactly.
So,
Yep.
like I didn't just win at life. I won the actual game.
Right.
Now it's in the record books.
Right. Right. Exactly. Exactly. It's really kind of neat to see how it plays out in different life domains. That's for sure. And athletics is certainly one where you see it a lot.
I just had this word coming into my mind as we were talking. The sort of ultimate way of feeling, which is joy.
Yes.
And when I think about the things that have gotten in the way of it, or I've allowed to get in the way of it, that experiencing joy is such a wonderful thing. And it seems kind of elusive a lot of the time, especially when I'm looking outside myself at the way the world is.
Yes.
And how people treat each other. And,
oh, yeah.
All the sort of hopelessness that is just kind of evident. And that sort of balance between how do I see that, know what that is, and then also in my day-to-day life experience joy without having it stained by all this other stuff.
Yeah.
I think it's just a life struggle for anyone. It's, there's, if you're observant and aware and actually have some compassion and some understanding of suffering and different types of things, and this is more of almost like a philosophical question more than a psychotherapy question, although they're very tied together, is that balance between, a personal meaning and joy in the face of these other things that are going on there. And you're seeing it in very strong terms in your practice, things that are just horrific, honestly, horrific.
I think many of us, maybe speaking just from my generation, are raised to not really exist for long periods of time in success. You don't want to be arrogant. You don't want to be cocky. You want to be confident. So a lot of us have been conditioned to downplay good experiences and sort of brush them off modestly or not acknowledge them at all. And I think in a way, that's a barrier to joy, because a lot of people have the mechanism within them that, okay, I've hit my ration of happiness. I've got to go back now. I can't be too happy for too long. That's just not, we don't do that. So it's an interesting, way to look at things, because I think we do ration joy into our lives, and some people feel they don't deserve it at all. Yeah. So it's a very complex concept.
Well, there's a word it's a Yiddish word. I don't know if you've ever heard it. It's kenahora. I don't know if you've ever heard that word.
No, I have not.
And basically what it means, the simple version of it is, don't get too happy, because God will see it, take it away, and take away even more.
Yeah.
And I don't know if that's sort of from the idea of, the Jewish people being, treated the way they were treated for centuries, that it's a thing. It's almost like a genetic way of being that was, and it was kind of there as I grew up. I didn't hear the word a lot or anything, but that was a feeling that was there. It's like if you're too happy, either other people will see it and try to take it away, or the universe will try to do that because you're not supposed to. It's an interesting sort of cultural thing. I don't know if I'm sure other cultures have it too.
Yeah, it's this ingrained kind of, make sure both sides of the ledger sheet are balanced. The emotional ledger sheet. Don't get too high, don't get too low. But if you get too low, that's probably better than getting too high. Yeah. I was raised, Catholic, and the Catholic guilt concept was very much, there as well. So it worked to help, at the very least, balance things out.
There's that guilt feeling that humans are so good at doing to themselves
For
and
sure.
their and each other, and it is a manipulation tool also.
Oh, yes.
Yeah,
Of course. Of course. Yeah. Very much so.
I remember once saying, this was kind of a funny moment. My mother was saying some things to me, and I said, "Could you just do me a favor and stop trying to make me feel guilty?" And she says, "I can't help it if you feel guilty." And my response was, "I actually don't. I just don't enjoy having you trying to get me there." It kind of ended the situation, but we both kind of laughed about it, but it was such a part of the dynamic growing up, I suppose. But, and then as an adult, you can say, sort of analyze what's going on and realize that, oh, this person is actually doing this thing they used to do all the time when I was younger. And
Right.
I don't have to get mad about it. I can just
Right.
ask for what I want.
Exactly. I have a choice. I have the luxury of choice. And that's an empowering thing when you actually realize that.
Another good one is just because somebody asks you a question doesn't mean you have to answer it.
How many times do people lead with, "Hey, can I ask you a question?" You know, often we are polite and, you know, comply, but sometimes, you can say, "No, I can't right now."
Mm-hmm.
And I think others may be off put by that. But it's as abrasive as it may sound, it's not a horrible boundary.
Yeah, I don't think it's abrasive at all. I think can I ask you a question can be kind of invasive, but
For
on
sure.
that person's part.
For sure.
So if now it's all on you. And so you're getting ready to be. You got your defenses up because by asking that, it's probably that they're saying it because they want to soften the blow, maybe.
Yes. Yes.
But it's going to be a blow.
Right. Right.
My answer
Right.
to that when somebody says, "Can I ask you a question?" I say, "Just one, but you just used it up."
or the lead in of, I don't want to be rude, but, it's like, okay, I know it's coming now. So,
Yeah, no, it's a tricky thing. I mean, I'm wary of that opening statement from somebody. Can I ask you
exactly.
a question?
I'm gonna start practicing that in my life, just saying no, or you already did.
Yeah. The other one I say is, "I'm not taking questions right now."
Right, yeah.
like I'm at some podium and reporters are coming at me or something.
Exactly. I'm just making a statement. No questions today, please. So,
well, it's that navigation of interpersonal relationships is always it's trying sometimes, where you just and I think that one of the greatest things about spending time by yourself is you don't have to deal with any of that. I'm not saying isolation or any of that kind of stuff. Just
no.
time where you're just being with yourself is a really valuable thing. I've always loved it. I've always loved it.
Meditation is built on that premise of just being with you, reflecting, listening to your mind and your body. It's very therapeutic.
Yeah, I'm a big fan of that. My wife is the same way. She likes to do that too. So it's
very powerful.
Yeah, and it's nobody feels like they're being neglected or anything like that. It's just, okay, yeah, you want to be alone, go do it.
Yeah, have some time. It's healthy for all of us to do that.
What is some of the most common things that are happening in your practice now that may not have been a thing 30 years ago when you started? Like, what are there societal issues that are coming up more frequently now that you didn't see back in the day?
Yeah, I mean, a couple things dating back a couple years ago, and still to this day, sexual abuse, the revelation of sexual abuse by either high profile perpetrators, high profile victims, and then I think more recently, Um, People are trying to process the political landscape and things that are happening. Um, and everybody's got a little bit of a different feel on that, but a lot of people are hurting by the things that they see around them, and it's just a lot different than maybe it would have been earlier on. I think there's more, in social media and the internet, we're more informed now, I think much to our detriment than we were 20 years ago, 25 years ago. If something happens, we know it in a minute, in a couple seconds. I think it's definitely those two things, and they're both very much in front and center today.
The information is so immediate. Sometimes it's actually in real time. The only response to some of this stuff is just being either afraid or disgusted, or and then the response to that is usually anger and
Right.
frustration. And so it's I struggle with that myself. I have to be very careful about how much time I spend on any kind of media, because it really robs me of being able to be in the moment and enjoy things.
Exactly.
There's so much information coming so fast, and it's usually not great information. It's usually things that are difficult to see.
And helping people process that and just sort of understand how they can exist at the same time as something else existing that they can't feel they agree with or can live with. So
Yeah.
it's adaptive.
I say that's probably one of the biggest things that I struggle with these days is the things we're just talking about, is getting this information that is so unpleasant so often. So I have to, my only solution really is to be as kind as I can to other people and stay away from too much of that information, because now I'm getting affected in a way where I can't be somebody that's helpful.
Absolutely. And that's what I tell people, is that, your world is as big as you want it to be. And if you can infuse positives and health into the world that you live in, it will not only benefit you, but those that you come into contact with. And maybe that in and of itself can have a contagion effect against the things that are not going well. Control what you can, and, have a health-based emphasis in doing so.
Great message.
Yeah.
Unfortunately, we have run out of time. We got a little late start because of our technical issues. I could talk to you all day.
Yes, we could talk about this quite a while.
These are my favorite topics, among others, but this is, who we are, why are we here, where are we going, all the big questions.
Well, I am happy to come back anytime you want to have me, Bob. It was a pleasure today.
Yeah, same here. And anything you would like to promote, your counseling service or anything else, a website, what would you like to do?
Well, my practice is Mosaic Pathway Counseling. I'm located in Gurnee, Illinois. My website is Mosaic Pathway Counseling, all one word, .org. And check me out. There's some interesting things on the website.
Oh, great. Okay. You heard it here, folks. Thanks, Scott. You have a wonderful day.
You too, Bob. Thank you so much for having me.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. You can also listen on YouTube. That is The Exploding Human with Bob Nickman. Once again, I'd like to thank Scott Stolarik for being on the show, and you can find out more at Mosaic Pathway Counseling. Thank you.